Okay, we're on.
Okay, so let me start reading the script and hopefully some of our other members will join. As a preliminary matter, this is Gary Bella, Chair of the Advisory Committee for Non-Voting Taxpayers. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. If you'd like, you can just raise your hand. I'll see you. And that's Lou Pisano.
Here.
Don Green. And that's Peter Kahn.
Peter Halley here.
Oh, Peter Halley. I thought you weren't going to be there.
No,
Oh,
I
Peter
didn't.
Kahn.
I can't make it. Oh, good. I'm glad to see you, Peter. Kathy. And that's all I see. And then, in addition, we have Dennis. We have Denise from the FinCom, and we have George from the FinCom. And we also have Rachel, who is our guest speaker. So glad you're all there. This open meeting of the ACNVT is being conducted remotely, consistent with Governor Baker's executive order of March 12th due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and that's the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting may feature public comment. For this meeting, the ACNVT is convening by video conference via Zoom app as posted on the town's website. Please note this meeting is being recorded and all attendees are participating by video conference. All supporting materials have been provided. Members of this body are available on the town's website. Public is encouraged to follow along. The ground rules, before we go to the first item, permit me to cover some ground rules. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you. Members wish to engage in a conversation with other members, please do so through the chair. And with items of public comment, the chair will afford public comment to those members of the public that have joined the meeting via Zoom. And finally, each votes taken in this meeting will be conducted by roll call vote. Okay, we got through that. That's the 1800th time. Some of you folks have heard this speech, but I guess it happens at every meeting. I see we have, in addition to the folks that I talked to before, we have someone named Kate Shea. Kate, welcome to the meeting. You are attending as?
Hi, thank you. I'm just Walsh Street, 68-year-long summer resident.
Great, terrific. Okay, welcome to the meeting.
Hi.
And Kathy, so do you know if any of our other members are going to be joining us? So I don't think we have a quorum yet, so we can, but nevertheless, we are starting our meeting.
Yeah, Bill Gardner said he couldn't make it either.
Oh, okay. We don't know about a couple of the others. Okay, so I would normally go to the approval of the proposed minutes, but since we don't have a quorum, I think we'll skip that. And so instead, we'll go to our first item on the agenda. And we're fortunate to have Rachel Day with us today. Thank you for being with us, Rachel. And as one of the deputy town managers, she has responsibility for several functions. She can talk about that in just a moment. But I have to say that I sent Rachel a whole bunch of questions prior to the meeting.
Yes.
And I didn't know what I was doing was prepping her for the select board, because at the select board meeting, she had to make a presentation, which she did brilliantly.
Oh, thank you.
And unlike us, nobody on the select board asked any difficult questions after she got through. But I'm not sure you'll get away with that here, but maybe
Yeah,
you
I'm
might.
afraid not.
Right. But anyway, nevertheless, welcome to the meeting.
Thank
And
you.
why don't you begin and tell us a little bit about your responsibilities, and then you can start talking about some of the questions that I asked you to talk to us about, which I think our members would be interested in. Okay,
Sure.
you're on.
So I'm not sure everybody is aware, but there was a determination by a staffing study that was done by the Novak Consulting Group. I believe the report was done about finalized in December 2018. And 2019 is when we got the majority of the goals. There were, I believe, a little over 100. I want to say there was maybe 104 of them that came out of that study. Some are still very much ongoing. Some are unable to be met. But one of them was to provide for a second assistant town manager. And what that did is that we're allowed to break out the operations of the town that relates to negotiations, collective bargaining, labor relations, budget, policy, just the general functions and operations of the town, and supervision and oversight of some of the departments that, unlike police, fire, that have direct line to Libby, while the rest, culture and tourism, health and human services, those do as well, but they sort of get filtered through the assistant town manager. And that was determined to have one person just focused on those things, and then break out to a special projects assistant town manager. So previously, Greg Tivnan was the assistant town manager, the one and only. And then once they added the second, he became in charge of the special projects. So not necessarily just capital related things, but items such as the hazard mitigation, sustainability, the marijuana dispensary, collective agreements, things like that, he manages and in charge of. It was just becoming a lot of responsibilities and duties on one person. So that position came up and I applied. I was previously the human services director. So that was a nice, easy transition for me to still oversee that department and provide some assistance there for the person who took there. Prior to that, I was the director or the administrator of the nursing home. So I still have that as a direct report to me. So that's also very helpful. I still hold my nursing home administrator's license so that I can provide that direct oversight or step in as needed in terms of management over there. So that's a little bit about where I am. I've been with the town for 15 years. I originally started at the senior center and moved over to the nursing home and then kind of moved through the town from there. So I did provide that presentation on the 23rd, this past Wednesday, for the end of year budget for the fiscal 20 for the Island Home. Even though we do have an interim administrator over there, I do still provide a lot of direct oversight and of the fiscal management as best I can and help answer a lot of questions. They're great over there with the day-to-day. They have a really strong team, especially through everything that's happened with COVID. Nursing homes have been a very targeted and in the spotlight of the management of this. The Department of Public Health has also provided a lot of extra surveys. Usually we get one, possibly two every year that just looks at how the operations are going for nursing homes and make sure that we're in compliance with the regulations. And this year they've had multiple to ensure that they're following infection control, COVID related things. So they've done a really good job in management of that over there. And I've tried to help more on the operations side. I don't know if you want me to go too far into the Island Home or if you want me to dive into any of the questions that you have. I didn't really prepare anything other than that, because I figured I could start diving into questions that would provide more conversation than just hearing me talk, because I could talk for hours.
Okay. Well, I know that you're completely familiar with all of the details of the Old Island home. And one thing I must say that if you read the Inky, which I'm sure all of you do, and you read the letters to the editor this week, you would see what a sensitive subject Old Island Home is in this community. One of the questions I asked you was to explain to us the difference between the senior facilities, Sherburne Commons, and Old Island Home. And I know there are some thoughts being considered now around the town as to whether or not the two different types of facilities ought to be co-located. So tell us first about Sherburne Commons. That's not owned by the town, but why don't you explain? It's a private institution or what?
It's owned by a nonprofit. So there's a local nonprofit group that owns that now and manages it privately. And they, unlike the Island Home, it's more considered a public entity. We are certified through Medicare and Medicaid. So those are some of our main payer sources there, as well as privately. However, at Sherburne Commons, they do not have that. They are private. They have independent living. They have also assisted living. So they do have individuals who come in, not necessarily through the Sherburne Commons community themselves, but they do have people who come in and assist with some of the daily care needs. But it is very much an assisted living and independent living facility versus the Island Home, which is a 24/7 skilled, as well as custodial care is the old term, but it's one that most people understand. Custodial care for those who need it. It's not necessarily just for seniors or elders. It could be for any age, just anybody that requires any type of assistance or supervision, help with what's called activities of daily living. So eating, dressing, bathing, those type of items on a consistent basis that cannot live independently. And that's been some of the discussion that we've had through the years on how to provide the right level of care that people truly need here. So some people who are at the Island Home maybe could manage at home if they could afford the live-in care or a home aide or somebody of that nature to come in if they could pay for that. In the past, we haven't had a lot of that in the community in terms of services, but that has increased through the years. We've noticed a huge trend in the industry for finances, especially that long-term care was being reviewed and noticed that a lot of the federal and state funding to provide care, mostly to seniors, but to those who needed some type of 24/7 skilled care, was in a skilled nursing setting. And it was a lot. And so they've done a lot of work to change how they provide those payments. And a lot of it is on assessments that are provided so that they can say, well, this person needs this level of care. This is the amount of hours or minutes of service that they're receiving. So this is how much we're going to reimburse you. Medicare does the same thing. And so throughout that continuum, for instance, Mass Health, we could have two residents who are Mass Health, but one has more needs. So we might get maybe $380 a day for that person versus $184 for the other. So it's very based on the individual's needs. And so we get a lot of that through the nursing home. So if you cannot pay privately, right now our rates are, I believe it's $560 a day for private pay. And if you cannot pay that or you do not have the assets, you usually apply through the Medicaid program and get Mass Health. And then that's how you get reimbursed. Sherburne Commons, though, does not have that provision. They are not certified to do that, and they have more of an assisted living, and it's not 24/7. So Sherburne is on town-owned land, which is why the discussion has been there about that location. It's not necessarily related to the services per se that they provide, but it was a location that was looked at. So in the very beginning, when we started this process years and years and years ago, we looked at different properties besides the current location to build a new facility. And that was one of them. Actually, when I first started working at the nursing home in 2008, that was being looked at then as well. So it's not a new concept. It's not something that suddenly came up over the past year or so. This has been something that's been reviewed for a while. Also, way back then, continuing care communities were starting to become a more popular thing in the industry. And what that means is they were looking at places where you could age in place. So you go, maybe you're in independent living, but you can't, maintaining your own home or staying in your home was no longer something that was very productive for you or conducive for you. So you would go and have an independent living. And then as you maybe started to decline, either mentally or physically or both, you would then kind of move through the continuum of care that was provided on this campus, which I know is a word that many people don't like. But you could start in an independent living, then you could progress and move to an assisted living. And then as you went from there, you would progress to the 24/7 skilled nursing facility. So you sort of stayed within the same area. You had very similar people that were around you. So as you transitioned, it wasn't as much of a shock and it wasn't as hard to transition because you were already in a community that you were comfortable with. And a reason why a lot of these places were successful, especially in smaller communities, which is something that we started looking at here years ago, was because a lot of times people enter independent living or assisted living together as a couple. And you don't necessarily age at the same rate as your spouse. And that also provides them the opportunity to get the services they needed for one versus the other at the same time. So there was a lot of benefits to it, and we started looking at it then. So that's sort of where Sherburne Commons came into play. Even though it's owned and operated by two different entities, two different business models, everything, it was town-owned land, and there was an ability to possibly look to do it there. And it sort of made sense. I know that there was some discussion about sharing services. Is there a way to provide more collaboration? And that's just a natural thing that you look at when you start looking at ways to make things more efficient. It's no secret that the Island Home runs a deficit. As you know, that there was the discussion to have the $5 million override on the ballot that wasn't brought forth to town meeting yet, but hopefully will next year. And that sort of came out of where we're currently at with the finances. And each year it's grown a little bit as personnel costs have grown, as cost to provide care has grown, and our reimbursements hasn't necessarily increased as our cost increased. So our rates have sort of increased mildly, but not at the percentage that's needed to offset the cost of providing care there. For example, we just finished our annual cost report. So every facility that gets Medicare, Medicaid, we have to file a cost report to the state and to the federal government through the Centers of Medicare and Medicaid Services. And we present to them all the costs that were associated with the facility. It's a calendar year, which can be a little challenging for us as a government-owned facility since all of our budget and financing is based on a fiscal year. But we work with our finance department very closely, and thankfully they are wonderful. So they help us out a lot in getting the reports that we need and provide that. And so based on our 2019 calendar year, January to December, it was determined that the cost to provide care to every resident per bed, whether it's filled or not, is about $585 a day. Right now, our census at the Island Home is 33 out of 45 beds. So that's a big chunk of our beds in our census that is not filled. And even if we do not have people or residents, as we call them, individuals in those beds providing care and getting some kind of reimbursement, we still lose $585 a day per bed throughout the calendar year. So that's where that $5 million sort of comes from. We offset that. Oh, I'm sorry.
That's paid by the town. The subsidy is paid by the town?
Mm-hmm. Yes. So we use, even though we're an enterprise fund, and ultimately as an enterprise fund, what that should mean is that we bring in our own revenue to offset our own expenses. Unfortunately, the Island Home has never brought in enough revenue, and our costs are too high to do that. So we have what's called a general fund subsidy. So there is a portion of the general fund that goes to the Island Home every year to help offset those personnel costs. We also, instead of using all of the general fund subsidy, we also have what's called certified retained earnings. And we have been lucky as a facility. So any revenue that we bring in over budget for each line item for private, Medicaid, Medicare, and any additional money that comes from the state for any unknown reason that we might get some, whatever is not budgeted, we have to wait. The Department of Revenue comes, they do an audit, and then they certify that. We're still waiting for our current amount of retained earnings to be certified because the audit was just done, but we should get that in I believe maybe next week or so. Denise probably has more information on that than I do. But a lot of times what we do is we have a certain amount of money that does come in over what our budgeted revenue is. And that goes to what we call our certified retained earnings. And we can't use it within the year that we receive it because it has to be certified, but we use it and we apply it to the deficit for the next year. So one thing that we do get through the nursing home, which is amazing, we are the only government-owned nursing home left in Massachusetts. And there was legislation brought forth in 2009 that provided for any nursing home that used federal funds, public funds. So in this case, the Nantucket taxpayer money to provide services of this nature can apply through what's called the certified public expenditure. And we say, this is how much public money we have spent to provide this service to the community. And they, based on some very complicated formula that I still have yet to figure out after all these years. And every time I ask them to explain it to me, I feel like they don't even know themselves sometimes. We get some of that funding back. And so that's the CPE that we call it, the Certified Public Expenditure. One thing that we've run into, we've never been able to budget that like our private rates, Medicare and Medicaid revenue, because it's an unstable funding source. And what that means is we never exactly know how much we're going to get when we get it, or if we even get it. So because of that, and because of the rules that are surrounding how we have to build our budgets, we can never make that as part of our normal funding stream. So when that money does come in, it usually brings us over budget. It goes to certified retained earnings, and then we can use that in the next cycle to help offset the anticipated deficit. One thing that we've run into this year, we believe COVID obviously had a huge influence on this, because there was a lot that normal operations that did not happen. But we have not received that funding that was for calendar year 2018 in our last fiscal year, fiscal 20. And so that's a concern of ours, because without that funding, even though we've met our budgeted revenue, we don't have that extra money coming in. It doesn't get certified. We won't be able to use it in a future budget year. So we've relied heavily on that. And I believe we were about 1.3 million. I don't want to misquote myself. So our fiscal 20, we used $2,276,000 of the general fund, and we used $2,687,000 in our retained earnings. So without that CPE to help boost our retained earnings value, we would have to take more from the general fund. And that's a huge concern of ours for future budget years, because that means that we would be able to not fund other services that are normal town services in other departments. We would have to be essentially taking from other departments in order to keep that deficit at the minimum. So that's sort of where that $5 million override comes into play. So we have a stable, known funding source that we don't want to have to be in this situation every year, but we're not really sure how we're going to fund the island home and what we might have to impact outside of that.
So let me ask you some of the hard questions that I asked you. One of my colleagues here, which is, we have 33 occupants now. We have 45 beds, 33 occupants. So tell me how much it's costing us per occupant to occupy Old Island Home. 33 divided by 5 million, 6 million. I don't know what it is. It sounds like an enormous amount of money for for us to be paying for 33 or even 40 people. Tell us what that number is and why. And that's probably why no other municipality in the state of Massachusetts feels that it's necessary to have their own facility. So what's
Rachel, if I could jump in for a minute.
Sure.
So Gary, to your question, that is it's a valid question. And I think you have to also look at it so if there's 33 residents, let's say there's 10 family members on island who are being able to stay with their family. So I never look at it as number of residents. I look at it as the number of people it impacts on Nantucket. So yes, you can divide that number, and Rachel can give you that number in a minute. And it also has a knock-on effect, or maybe not. And it also has a knock-on effect of all these other people, all your family members are also impacted. So it's not just impacting 33 people to have this facility. And you're absolutely right. This is why every other municipality in Massachusetts, and if we weren't an island, I'm quite sure we could make other decisions. But being an island, it definitely impacts whether you can take care of your elders in a safe place, co-located with their families. So I just wanted to kind of add that to it. And Rachel, I'll stop talking so you go back.
You're fine.
Well, as a follow-up to that, just a quick thought about what does the vineyard do?
They have a little bit of a different situation over there throughout the years. Their nursing home is connected through their hospital, but they, through the years, especially when I was the administrator there, Ken Shalom used to be the administrator years ago, and he would reach out to me often saying, you know, we're seeing an increase in shipping costs for our, you know, food. How are you handling that? We're seeing this, we're seeing that. And a lot of their challenges were the same challenges that we had. I certainly would echo Denise. I think our expenses are a little under 8.5 million. So you can certainly do the math to say this is X number of residents. It's hard to actually put that number to value the way Denise was saying, because even though we average right now, our census has been low. You know, one of the myth assumptions out there that is that we've had a wait list for years, and we haven't. We've actually functioned in the mid-30s as an average census for a little while now. And we're not exactly sure what that means, but how we are using that information to see what the future options of the island home might be. But we also do have a lot of admission discharges each month. So as we go through the year, even though the number is around 33 to 35, essentially we're really looking at maybe 50 people that have come through the island home as just the individuals that are getting the care. But I certainly echo exactly what Denise is saying. There is such a human element to providing this service for the town that you just can't put a value on. I even saw it yesterday. There was a very beautiful couple that got married. They actually met through the nursing home because of their grandmother was there, and there was a worker there, and you could just see there's a very large family connected to this one individual who resided in the nursing home, and you could just tell the impact that being able to keep their loved one on island, provide care, see them whenever they wanted, the human impact of that it's so hard to put a dollar amount. And I think that's why you see those letters to the editor. I personally myself did not read them yet from this past week, but I have been a part of this long enough to know that the emotion that is involved in every discussion that relates to what happens with the island home, whether it comes to just the general operating budget versus what do we do with a new building. If not, it ends up becoming a very emotional conversation. It's because you are talking about caring about people and their lives and their loved ones. And it's a very hard thing to put a value on. That's one of the things that we're working on right now. Denise has been part of that process as well, is that, you know, we've been talking about future of the island home. What do we do? You know, the current building was built 1980. The nursing home used to be and operate out of the Landmark building before that building was built. And, you know, now it's outdated, it's aged. There's some systems that need to be upgraded there, electrical, plumbing, and providing care. You know, we've dealt with the state. We have two different surveys. One's the public health and one's life safety. And life safety deals with the building and, you know, fire codes, building codes, all of those things. And so we get into some really interesting conversations when those surveyors come, because they don't use the term grandfathered anymore. It's also not considered a politically correct term. So a lot of what happens is a lot of the new regulations, they can't really enforce them on us, but we are supposed to be trying to meet them. So we've done some renovations to the building through the years, but it's just not cutting it. So what do we do? So we've had a lot of different discussions. We've looked at the Sherburne Commons. So we had SMRT architects provide us with something that could be built at Sherburne Commons. As many know, that was voted down at a town meeting. And the feeling at the time was people just did not feel that we put enough, and I say people, and I mean some. This obviously wasn't the majority opinion of why they chose not to vote for that at that town meeting, but it was one of the reasons is that the view, they didn't want to give up the current location. They felt that we didn't do enough to look into and vet the current location and truly understand what could be done at the current site and what could it actually cost. So we sort of went back to square one, and we re-engaged that process. And then we started working with LWDA architects, and they provided us with, this is what could be done at the current location. It's not a well supported, I guess you could say. The two-story structure is a challenge to operations. It's very similar to the model that we already provide. We used to throw the term around institutionalized because it's got the long halls, but it does have private rooms versus what we were trying to accomplish at Sherburne Commons previously with SMRT, which was a more home-like environment. So how do we get those qualities that we want into a new building? And that's what LWDA provided us with as a feasibility study. And now what we're sort of doing is we're having stakeholders meetings. And so while we're not really sure that that's where people want to go, and the cost to do that at the current site was very large. If anybody followed that, we were looking somewhere around the ballpark of, I believe, $40 to $50 million as a phase construction, and the impact of the residents that were currently living there, along with the staff that are there, which we have about 50 staff members. So what we're doing now is we're having some stakeholder meetings. I believe there's 5. They met with nursing staff, Island Home residents, and our ombudsman, which is a advocate through the state for our residents that is not affiliated with the facility. They met with resident, family, and friends, non-nursing staff of the island, and then community stakeholders. And a lot of what we saw that was coming out of that was we had it moderated by a man named Herb Taylor so that he was able to keep things on track and non-biased. He doesn't have any stake in any decision that's made. And the way we started these off was, what are the core values of Nantucket that are being considered, that are impacting what we do with the Island Home going forward? And one of the biggest things that I heard, and I know Denise was part of that, so she could also chime in here, was we take care of our own. And so I think that that is a very strong connection, feeling, emotion. So even though right now we have 33 people, even if you don't have a loved one there, knowing that that service is there for you if you ever needed it is something that we saw as like a very driving force in what people decide they might support the town doing in the future for the nursing home or not. I don't know if I answered your question. I sort of went on.
But you did not give us the number that it
I
cost.
did not. Well, if you take, I guess you could take just over, just under 8.5 million and divide it by 33.
Yep.
That would look to be about 257,575 and change
About
per resident.
$50,000 a year for each occupied bed.
Right now, what's occupied?
Right.
Yep. If you divided that by 45, if we had all occupied, that would go down a little bit. But yeah, that is
Right.
a significant cost.
And when the stakeholders, by the way, I assume we the non-voting taxpayers that pay 80% or 85% of all of the costs, we're not one of the constituents that is whose views are sought as to whether this is a appropriate way to spend the money, right? We're not going to.
Yeah, so we didn't really, we will have more that are going to expand more towards public. And so when I say stakeholders, what we did is we looked at who in the community right now is very in tune with providing these type of services. So we had representatives from Sherburne Commons. We had some representatives from other agencies that provide geriatric care management in the community, the hospital, elder services. So those are who I meant by the stakeholders of this small forum. But we will have to expand this to outside of nursing home staff, residents, family, and those stakeholders, to just general community members, as well as individuals like you who are non-voting taxpayers. Because ultimately, we could sit there and talk to the staff and the residents and all of them and what they want all day long. But we have seen in the past that ultimately, when it goes to town meeting, is where we move forward. So without that input also from the community to know truly what people will support and what they won't support, you know, that's where we need to go. So yes, there will be more to come, certainly on that. And we're just.
Do you think they know? Do you think the people who are being asked about this, that they know that it's costing $250,000 a bed to keep this facility going this way?
They probably don't know that exact figure because that's based on the 33 active residents we have now. Like if you asked me that question last year, it would have been less. And, you know, if you ask me that question next week, if we get a bunch of admissions, it could be less as well. So it's a very moving target number. But I think the thing that's most important to focus on is, you know, regardless of what our census is and what it might cost per resident that's there actively at that moment, is it's $5 million a fiscal year. That's where that override comes from, and that's where that conversation comes from. And we've heard many different things. You know, it's very hard. There's not, some people don't want to voice their opinion. I've had side conversations with people, you know, they don't want to see the island home go away, but that number scares them. That's a very large number. And the question sort of, you know, in a roundabout way, it comes up, you know, why is the town still running this? This isn't a normal town function. Why are they doing that? And I think a lot of that comes down to what our core values are that are driving what we decide as a community we want to provide. And a lot of that relates to, we want to take care of our own. So people are willing and do want to support the nursing home at that cost and understand that cost so that they can keep providing for our own here. Denise alluded to it before that, you know, maybe if we were in an island, we would have different options. And I want to expand upon that a little bit, because I think that that's a very key, important part of some of the conversations that we've had, is that we don't have other services here. While there are some more private care services, at-home care services that are becoming more expanded in our community, more available in our community, so that people can stay home and, you know, age in place in their home longer. We don't have other services here that maybe are more accessible off island for people. So we might have some people who are in the nursing home that are just minimally qualified to truly be there, which means that they could be better cared for in a lower grade setting. So this is where the conversation sort of came before. Right now we have what's called level 2 and 3 beds. So that's skilled care, round the clock care. They need a lot of assistance with their activities of daily living. And then there's a thing called level 4 beds, which are considered also like rest home. So similar to what Sherburne Commons is doing, it's more of a supportive care. You don't need somebody to monitor you 24/7. You don't need a doctor's care plan to be sure. You have a lot of more independence than what you normally would have if you were in a level 2 or 3, where you need that 24/7. And so some of that conversation said, well, we do have people at the island home that might better thrive in that type of environment. We just don't have those that they can afford here. So maybe they could go to Sherburne Commons, but they can't afford it. And maybe they could stay home, but they can't afford the private care. So they end up coming to the island home by default, where when they were off island, they might have more of these level 4 or rest homes, or more options of care levels that they could go into, like the continuing care communities. So I think that also drives some of this, is that we do know that our costs are a lot there, but if we were to provide a model that provides that lower level of care, like the level 4 beds, plus some of the level 2 or 3, our own personnel costs and operating costs would go down, and we can still take care of our own, just not at the high cost that we're seeing right now at the nursing home level. So I know that's sort of, sometimes it's hard to wrap your head around. I hope I'm explaining it right. Since I've been doing this so long, it makes the most sense to me, but you know, if it doesn't quite make sense to you, please ask me to expand upon it a little bit. But a lot of it relates to the operations override. So we could maybe bring that cost down. We did some work years ago with some financial consultants to say, if we ever were to make the island home not lose money, break even, what would that look like? And it's just not something that would work here as a model. I think we, at the time, and it might be very different today, but at the time, I think we were looking at, we needed 112 or 115 beds, and they needed to be filled. And obviously with our current census, there's no way that we would do that. The other something, I was just gonna say something and it totally popped out of my head.
Don had a question. Don Green had a question.
Yes, please.
I am a retired physician. I spent over 30 years attending patients in nursing homes. In fact, an abundance of 50 of them at one time. It was there are things about the economics of this that it's getting lost. First of all, your probably most major cost is labor.
Yes.
And when
it's about
those people
80%.
Yes. So how many people are needed to attend to one person in the nursing home?
It varies by the shift. So during the day, industry standards show, I believe it's 8 to 1 resident. So you have, I'm sorry, other way around. You have 8 residents per 1 aide. So we are staffed a little bit higher than that right now, obviously, since we have only 33 of the 45 beds filled. And then it kind of increases. We might be at 6 to 1 right now. I'm sorry, I don't know that as well. But then in the eve shift, it goes a little bit more. And then at night, so at our night shift right now, we have 3 aides. And so that's the 11 p.m. to 7 a.m. shift. And some of that is not necessarily driven by census, it's driven by the building layout. So we have the 3 different wings, and it's just not
my
safe.
point I'm trying to make, it takes a lot of people to take care of
It does, yes.
people. The other thing is it's a cost shift. It goes to level 4 beds. That's an extra cost put somewhere. You can't make that much of a difference on your costs for the people that remain on higher care. The other thing is just general economics. When people earn that money in a nursing home, where does it go? It's spent in your community.
Right.
It actually supports the community by giving people a very important job. So I don't think, people have to just decide what their values are. And if this is the way people should be taken care of, then it should be supported, because money is not really lost. It goes to people who have value, and they use that money to take care of their own lives. And usually it's not at a tremendously high level. I don't know what the average salary is at the nursing home. Do you have any?
And you bring up a good point, because like I said, we do have about 50 employees there. So that was one of the things when we started looking at what the options are. And one of them, the most not liked option, but you still mention it because it is an option and you still have to have the discussion, is that you just stop running the nursing home, you close. And we have always never really wanted to explore that, because not only are you now not having that option here to provide that level of care, but now you're also displacing 50 people and their livelihood. And that's 50 people in our community that are losing their jobs. And so that's been another, personal, emotional factor that has gone into what our values are and why we're deciding to do what we're doing.
And you haven't solved the problem, because those people still need to be taken care of somewhere.
Correct.
So we are one country.
Mm-hmm.
So, that has to be kept in mind. If you're not paying, somebody else is supporting through some manner. Maybe sometime in the future, people will see that this is a public good and it will be financed that way. So all this very complicated financing can be done away with.
And we're, the whole island factor is there too. There are other facilities off island. So Taunton, for instance, was our other government-owned facility left in the state. And they chose, because once the CPE, because they also got that funding, once that and their costs were becoming too much for them, they chose as a town to close their facility. And the biggest difference that we have there is that they're responsible when they close to help relocate those residents and those families, and they had those options to do. So it was hard, and they maybe had to go to a neighboring state. Maybe the drive to visit their loved ones was a little bit more, but they looked at that as one of their factors. And I will not speak for Taunton and what their, everything that went into their decisions, but they had that ability that was a little bit stronger because they could move to other locations. Here, if we did that at the island home, our only choice would be to displace residents off island, and the hardship that would cost to individuals to visit their loved ones, especially during certain months, like where we have boats that don't go for a couple days, when there are some people who come every day. And that type of impact, now you're not just impacting that one resident that one of our 33, now you're impacting the emotional, social well-being of their spouse, their family, everybody else that's now not able to have that human connection.
Yeah.
So there's a lot of factors that come into play.
Peter, you had a question?
One is that have summer residents become residents of our island home? And is that a possibility? And along with that, if I had a relative who was in this sort of nursing facility someplace else, and I'm spending the summer in Nantucket, is there availability in those extra beds to house my relative while I'm in Nantucket?
So I love this question. Thank you. This was one of the ones that was sort of forwarded to me. It still surprises me a little bit that there are some people who believe that you cannot go into the island home unless you are a year-round resident or a taxpayer, and that is just not true. We have people who come from all over. We've had people who come here just for the summer season, and they have an elder parent or grandparent, and they bring them with them, and they put them in the island home as a way to help provide the care that they still need, since they're not able to provide it in the community. We sort of call that respite stays, where they might come for a week, 2 weeks, but we do have that as an option. You do not have to be a resident here. We've had people who have called and said, I used to live there 10 years ago. I loved it. It's beautiful there. I'm looking to placement. Can you send me information on how I apply? Or my mother, my sister, we've come from all over. So no, you do not need to be a year-round resident. And you do not need to be a current taxpayer in order to go into the nursing home. That's not a requirement at all.
I was hoping that would be the answer.
Yes.
Yeah.
It is funny, but there are a lot of people who still believe, and they'll call and say, is there any way around this? And we said, of course, because it's not a requirement. So it's interesting.
Getting back to these nasty numbers, I want to see if I'm understanding correctly, and I'll just round it out that it's basically $260,000 per bed. Well, actually $260,000 per resident, given the average number of people. But is it correct that that is not being entirely paid for by the town and town taxes? It only
Correct.
That. And
Correct.
Then what is that fraction? And then if you were to balance that off against the taxes being paid by those 50 people who are working at that home, I'm just wondering whether there isn't a net benefit or something close to zero detriment in terms of taxes.
Yeah, I like that. It's a really great way to look at it. Yes.
Thank you.
What we brought in for revenue, so our expenses, I'll use fiscal 20 because I have those numbers right in front of me since I just did that report to the select board. So this is great timing on the meeting. Our expenses were 7.65, I'll round up, 7.65 million for fiscal 20. And the revenue that we brought in was 4.2. So that's where it was about I'm sorry.
Can I just stop you there? Does that
Yep.
revenue include the revenue from the state and the
Yep.
everything, but not including the revenue from the town?
Correct.
Okay.
So we get Medicaid, we get reimbursement from Mass Health, which came in just under about 1.9 million for fiscal 20. We get Medicare. That's one thing that, being an island, other facilities, our Medicare census is a lot lower than most other facilities off island. That's ultimately what helps keep them afloat. We got about 500,000. We average anywhere from sometimes 1 to 3 of our residents are Medicare. And what that is it's more short-term rehab, high-level skilled. So other facilities off island we'll get directly individuals who have hip replacements, knee replacements, anything after a fall, extreme dialysis, strokes. So they get those individuals that are high rehab, high skilled nursing needs, and they get a higher reimbursement for the care they provide. We have a lot of challenges here. One, just providing that higher level of care, having the therapist. Right now we don't have speech therapy at the nursing home, while other facilities have a little bit more access to that. So we don't have that as a high revenue stream that other nursing homes do. So we got about 500,000 from Medicare. Private patient income, so those who are not qualified for Mass Health because they have their own assets or income or are not on the short-term Medicare reimbursement, that came in about 1.25, and that's for the people who pay about $560 a day to be at the nursing home. We also get some insurances, so anybody that has co-pays that when they're on Medicare, there are some long-term care insurances that will provide some reimbursement of care as long as we do the proper authorizations. So we do get those. And we have what's called patient paid amount. So even if you are qualified and you are falling under Mass Health, and Mass Health or Medicaid, I interchange the two terms and sometimes it confuses people, sorry about that. But if you are on Mass Health Medicaid and you do get a certain amount from the state to provide care, but you do still have an income, so you have a retirement or any other source of income that's coming in, they determine you get a certain amount for your own personal needs and what you're allowed to spend. They deduct certain qualifying things like your insurance premiums, and they go from there. And then they'll say, okay, this leaves $500 of your monthly income that you also pay to the nursing home, and we'll pay this to the nursing home. So we get some of that as well. And that came in at about $4.2 million. So it is not, yes, it's not fully funded through taxpayers. I guess you could say private pay is taxpayers' money too, but.
No. So what I didn't hear in terms of the revenue stream that was the retained earnings. If you also, because that again is a source of revenue that is not from the town, as I understand it. Not an allotment from the town. I don't know, what is that average per year, and what does then that take you?
So we have used, I believe in fiscal 19, we used 3 million. And I know for fiscal 20, we used 2,687,000 out of our retained earnings. And that by using that, we didn't have to use as much from the general fund. And we get our retained earnings, like I mentioned, usually from that certified public expenditure. So even though, and it's a very interesting concept when you look at it. So if we used X amount from our general fund subsidy, we then in a way get that back from the state, and they give us that funding back to say, you used X amount of taxpayer dollars to provide this service, we're going to give you this back, and then we use that in the future years. So if you really want to try and figure out how much is truly just, I guess you could say, lost in cost of taxpayer dollars to support this, and take all that back and forth into consideration, you'd have to probably look over like a 2 or 3 year span to see truly what the cycle is and figure that out. And it's not maybe as much as people think it is. So that's a really good point to make, but it's still a high number, but it's not probably as scary as people think.
Well, I think the number that Gary is sort of looking for, or at least the number that I would want to know as a non-resident taxpayer or as a taxpayer, what is the taxpayer bite? And that sounds like a relatively small number compared to the overall cost of providing this care in the year. And when I say taxpayer, I mean as a Nantucket property taxpayer, not as a Massachusetts income taxpayer, or a federal income taxpayer.
Right. I mean, Denise is far more in tune with these type of things than I am, but I would say the easiest, straightforward way to get people to understand that is to just look at what we used for the general fund subsidy every fiscal year. Look at that number and then divide that number. So for fiscal 19, I believe that was 1.5 million. And then for fiscal 20, we ended up using 2,276,000. So I would take that
Just looking at-
2.2 million and use
Yeah,
that.
looking at the higher number then, and using, I think, what 80/20 rule or something that the
85.
non pay about 80% of the taxes. You're talking about let's see, so 2 million times 80% of that is about what, $1.6 million,
But
which,
if
you know,
if I could just
great
jump in,
scheme of things is a very small amount.
if I could jump in for a minute,
go ahead,
Peter. So
Denise.
yes, the non-voting taxpayers do pay 85% of the property taxes, but
Right.
it's only 50%. It is 50% of Nantucket's total revenues because we have, you know, meals taxes, licensing fees, et cetera, et cetera, et cetera. So I know you use the 85% because that's of the property taxes, but for the total revenue of Nantucket, it's 50%. So that's a more,
I appreciate that. That's very relevant. And I guess the point that I was trying to make is that as a person who has relatives in, you know, assisted living at least, and that the proximity is such a benefit, not only to the individual in the facility, but to the people around them who wish that they were not in the facility. But maybe I put that the wrong way. No, they need to be in the facility, and it takes a burden off of them, but also they want to be close by and have as normal a relationship as possible. This is the only reason we're talking about this is because Nantucket is an island, as you say, that there's no convenient way of replacing this service that I can think of.
I mean, and to Rachel's points that she's been making, trust me, there hasn't been an option that hasn't been looked at in terms of, could someone else come in and manage it? They won't make money, full stop. So no one else wants to. You know, if we were on the mainland and we had a nursing home that was less than profitable, but you had the ability to go to a corporation that manages nursing homes, they could, as we all know who've been in business prior to, you know, our roles now, you can absorb a loss on something else, and, you know, in one place if it overall works into your portfolio, into the portfolio of offerings that you want to have. So, you know, we just don't have that option here. And the piece of it with 80 to 85% of our expenses at the nursing home are staffing. It's because we have minimum staffing levels that we have to adhere to. And tomorrow, if we had 5 people show up to be, so 5 people all of a sudden need physical therapy and they're going to show up and be at our island home, we can't just say, oh, I've got, you know, 12 therapists sitting in a drawer over here that I can open and have one pop out. So, you know, that adds to the complexity of staffing, is getting the right staffing on island as well. And yeah, it's difficult.
Yeah, I know. I think that one of the difficulties here is what I think is referred to as lumpy demand. And that means that you can cry about the fact that only there's a facility for 45, but there are only 33 people on average using it. But if you had 43 people in that facility, you'd be going crazy looking for a new facility, because you need facilities that basically certainly can meet the demand, but also are large enough so that you don't have to be building a new one every year, every time you get one new patient.
And we talk a lot about, you know, the building, the structure, the age, the systems that are in there, but there's also other elements. I mean, this is where people are now living. It is their home. And there are elements of our current facility and structure and how it's laid out that are just not, you know, it's not something that somebody says, yes, that's where I want to go. I want to go from having my own space, my own home, my own room, and now I want to go back and share a room with another individual and basically take my entire life and combine it down into a small amount of personal belongings. And not only that, now I want to not have my own bathroom. I want to share a communal shower. So there's elements of our current building that we recognize are not very, people, it's not attractive. It's not what people want to do as they're aging. They want to have more comfortable amenities. They want to have privacy. They want to have their own rooms. They'd like to have their own showers, their own bathrooms. And right now our building, the way it's set up and how it was done, and that was the model then, that, it's not like when it was built in 1980, anybody did anything wrong. They were doing what was the standard at the time. And now we're looking at it and saying, you know what? We could probably do this a little bit better. We can make people's life a little bit more comfortable. And here is what we're listening to them, and this is what they want. And it's also what the staff want. They see this and they say, you know what, like we want private rooms. We want to have space. And when you're visiting your loved one, it's sometimes very hard when you don't have that privacy to do that. And so we're looking at those type of elements as well as we're looking. So even though I sort of focused earlier on, the age, the building itself, there are those other elements, again, that go into the human aspect of what we're doing there and why we're looking into, what really needs to change with what we're looking at.
Don?
On that measure, actually, the first nursing homes I used to go to, everybody was in one room.
Mm-hmm.
This is a safety issue.
Yeah.
I've seen the flu go through such nursing homes, and people are dead within 48 hours. So there's a reason for making things not only private but more safe than they were before. And this pandemic has proved that.
Correct. I was just going to say
it runs through wildfires through facilities.
Absolutely.
And again, I have to emphasize the money is not lost. It's a matter of values where the money is spent, because it comes back to the community to support people who are doing what everyone should agree is very important work.
So a lot of the things that you touched on are not just, it's definitely infection control measures, as they call them, and through the regulations. And I really appreciate that you bringing that up. We've been learning a lot as like a crash course in how we're providing care and what's really a safety and not just a comfort thing for residents, but also to keep them safe and healthy. And you're right. Every year we usually do get a little bit of the flu season. We do our best to keep infection control measures down so that less residents are impacted or contract the flu. And now with COVID, we're seeing that impact as well. So there's a lot that's being discussed. There's a lot of articles I've been reading. The entire industry is really changing. And I think we're going to see a huge overhaul in nursing home regulations coming very soon that guide some of that and say how you are starting to build new facilities. I know when I was first licensed as an administrator, the regulations for nursing homes had not been updated in a fairly long time. And it wasn't up until maybe about 5 or 6 years ago that they'd had their probably largest overhaul. And a lot of that just had to do with staffing requirements and a few other elements of the building. And now I think we're really going to see more focus on infection control, more focus on the private rooms and the separation that we have been striving for. And we call them home-like features. And I think we're going to see a lot more of that. So I appreciate you bringing that up, because I really think that that will guide what our potential new facility or renovation of our current facility, whatever is chosen to be done, that really will guide what that looks like in the future.
Yes.
And the number of personnel needed to carry this out goes up when you want to make people safe.
Correct.
I know that Denise had to leave, so, and I was hoping she would hear this other question, and that relates to, so if we're talking about significant capital expense, and I don't know if that's that $50 million number that was mentioned in Libby's talk last month is a real number. And now we're also talking about the senior center, the Salt Marsh thing, which is another major project. So what are we talking about in terms of major capital type of obligations for the town of Nantucket? When you're talking about Old Island Home, you're talking about the Salt Marsh Center, all at the same time, that, and whether they can be somehow cobbled together to some cost savings. Is that something that the town has figured out how to do?
Let me jump in on this one, Rachel, because
Yep,
I do.
absolutely.
And so thanks for that question, Gary. And The idea is when we're taking a look at our island home and the Salt Marsh Center together is because it's to look at it holistically. So potentially, can we then reuse our island home if we build a new one at much less expense than it would be to renovate the current one? If we could build that on town-owned property and then renovate our island home or whatever you need to do and put the Salt Marsh Center there, because then the footprint's big enough and then all the seniors on island get to enjoy the view, not just the residents of our island home. You know, so we're trying to look at it kind of as a holistic, how do we take care of our seniors, as Rachel said, from the early days of care to the end days of care. And with the investments that would have to go with that, obviously we as a town, we'd have to stagger them. No town is going to, it's not fiscally prudent to write huge checks for several projects at the same time, nor could we manage several projects at the same time, right? It's just, it's just not fiscally prudent and operationally prudent. So, but the good point about this, or is the awareness of this, is the town management, the select board, the director of finance, everyone considers what's the right thing to do in the right way and the right sequence. Nobody just sits there and says, oh, let's start, you know, $100 million of capital projects because, you know, it's Tuesday. So it really is scrutinized, and we don't have any numbers yet, really no numbers I would count on or consider valid around what a new Our Island home would cost, what a new senior center would cost, what can be reused. When Rachel was referring to the 3 years ago or 4 years ago when the town voted to not move the current Our Island home, we got a price for how much would it cost to renovate it in place, because people needed to know, well, that decision you made at town meeting now has a price tag and a disruption factor that frankly is a non-starter. It just is a non-starter. So, and so that's, yeah, so that's, I hope that answers your question, that it's not just, it's definitely not looked at casually or whimsically. And because trust me, the local resident voters don't want to see a big tax bill increase either. You know, I'm right up there with a group that doesn't want to see a big jump in my taxes. And because all of a sudden we're doing all these capital projects and have debt exclusions and et cetera. So with that, it's nice to see all of you again. And I'm leaving you in George's, George, you want to wave so everybody sees it's you? I'm leaving you in George's good hands going forward. I will join when I can, but George is now your person. So Rachel, good job. And
Thank you.
everybody enjoy this
Thank you,
beautiful day on
Denise.
Island. Take care.
Thanks, Denise.
May I ask two
Luke.
questions about the
Bill, go ahead, Bill.
proposed new island home?
Yes.
One is, what would be the number of beds envisioned for a new island home? And the other question would be, what would be the expected lifetime use of that new building?
So we don't really have a proposed new island home right now. And I think that's the conversations that we're trying to explore, is what truly is the next step. But what we would have been doing, and the bed size has been a long-going discussion. Some people believe with our census anticipated to increase that we should be building for more beds. Others believe that because we're providing services to individuals that might be better cared for in rest beds versus skilled nursing, that we should have a mixture of both and not necessarily have 45 skilled beds, but have maybe 30. And that's not just random numbers thrown out there. That we did have a couple consultants help us with those figures a few years ago. And so I think we aren't necessarily looking originally to build 45, but a lot of conversations that we've had with the state, we can't just build whatever we want. And I think that's one thing that people sort of lose in the whole conversation. So if we decided magically tomorrow, this is what it's going to cost, everybody approves, this is what we're going to do, we start the process of filing a determination of need application. And we have to go to the Department of Public Health, and they review that. And they have to approve how many beds, what it looks like, our size, everything. So there's another level there. So even if we said this is what we want to do, they could come back and say, no, we don't see the need, we don't have that. There was a moratorium on beds for a very long time. COVID has sort of assisted in changing how we manage that. But we used to be able to take beds out of service. So we've done that at the Island Home a few times. So our license stays at 45 beds, but we only get charged based on whatever we say. So we could have taken 10 beds out of service. And so on our, even though our license says 45, we're operating at 35. And another thing that people might not know is that we pay a bed tax to the state. So every bed that we have, so we would only be paying on 35. It's called a user fee. We would only be paying on 35 instead of 45. But we wouldn't lose permanently those 10 beds. We're no longer able to do that. So one thing that's been discussed is right now we can't prove that we need 45 beds to the state because how our census average has been through the last couple of years, we haven't ever gone over. So we can't say we need to build for 50 beds because we can't show that we have the demand for 50 beds. But at least what we could do is say, well, we're current licensed for 45 and we don't want to lose that 45. And I think that would be a more agreeable thing. So we really have to strongly argue and prove why we would need more beds than what our current license exists. So I think one thing that we sort of get stuck on is our license is 45. So how do we maintain that? Because in the event that we might need more beds in the future, we don't want to lose that option. Before, when we had plans at Sherburne Commons, we provided to a facility for 40. We had 30 long skilled beds and 10 that were the level 4 rest beds, but we were trying to design it in a feasibility stage such that in the event that we needed more beds in the future, we could have built and added on to the structure to provide for that need, rather than locking into 45 for the next 50 years. And so I think that, to answer your second question, is what we were looking at. So right now, the building was built in 1980. We've occupied it for 40. We want to make sure that we get a very long life out of the next building that we build, especially if it's going to be a large capital expense. And so we were looking as, you know, how can we build for the next 50 years? That's the number that's always sort of been stuck in my head. I think others have gone higher and said, hey, we're going to be for 60. But I think, you know, 40 to 50 years is a life of the building is something that I recall us talking about when we had the building committee convened.
In terms of the lifetime of the building, probably one should add to the 8.5 million, another million for the amortized cost of the building. If the
Metros, yeah.
Yeah.
Yeah. And of course, they have to keep in mind coastal resiliency.
Correct.
50 years from now, the water level is going to be a lot higher. Anything near the
and the
flood
further
area.
question is, the further question is, if when they're talking about getting up toward 300,000 per patient, is there another way to spend that 300,000 for compassionate care by trying to keep as many people as possible in homes, in home settings, even if their own personal home is not able to accommodate the person otherwise in the island home?
Yes, that's an excellent thing for you to bring up. We've had a couple, we call them the Island Home Work Groups. They were public meetings, just like anything else. They were elected through the select board. And there was one that was, I believe, chaired, I want to say 2012. The report might have been 2013. I could be a little wrong on that. But it was chaired by David Worth. And one of the things that was a recommendation from that, even 7 years ago, was maybe we need less skilled beds, but what are providing, you know, would it make more sense that we start exploring how to provide home care or how to boost home care in our community that was a more affordable option to keep people in their home? Because things, you know, studies, examinations, finances has shown that the cost to provide care in the home is much cheaper than the cost not only to the state but the federal government as well in skilled nursing facilities. So that's where before I had mentioned that the industry is sort of shifting where they're putting their funding and reimbursement rates, and a lot of that funding was kind of going away from skilled care and going more into home care services to reimburse through Mass Health, to more entice people to follow that path and to provide that care that way. So that has been something that we've explored. So that's also where, you know, maybe providing for a building with less beds makes sense, because we might be able to find a way to increase the home care services in our community and keep people in their homes longer.
Don?
Thank you.
It won't happen. Well, because
It's hard.
the population's getting older.
Yeah.
So you're really shooting yourself in the foot here, and having a home service just adds to the overall cost of providing health care. It's another thing without changing what's happening from the place that you're trying to reduce the cost at, because you have those patients that need the care. Every hospital does not operate at 100% of capacity.
Right.
Usually, you know, they're golden if they can. It can be 80%, but they can even get by at less than that. But what happens? Like we have a pandemic now. Elective surgery, a lot of the other things have to go by the by. So, who knows what diseases or catastrophes are going to happen in a community, and you have to be prepared for it. This is why we failed so miserably during this pandemic, because it wasn't prepared for. There was no capacity for an emergency from the get-go. So, you know, people have to look at the system as having some elasticity for a time, because you can't predict the future. And you have to be ready to take care of medical problems when they arise. And again, you know, this taxpayer business always gets to me. If the taxes are wisely spent and go back into the community, I'm for it. You know, I've never seen anyone get pushed into poverty because of taxes. That doesn't happen.
Okay, Louis, do you have any questions? Luciano?
No, not right now.
Okay, Kathy, you have any?
Just in back to the fact that it's a little known fact that anyone can come into the facility. They don't have to be a taxpayer or anything that you mentioned earlier, Rachel. Is there any way to make that more widely known so that maybe you would have some more folks coming in?
We can fill 112 beds. We can fill 100.
This does right here.
Yeah. I do think we have it on our website, but you know, there could be, we've been doing a little bit of outreach. We've had some, we do a weekly, and I say we, but it's really a couple of the individuals over there. Our activity director has been, and our social worker does a letter to the families every week, things like that. And for a little bit there, we were putting a couple letters to the editor. I think we did do that at one point, clarifying some of these things as we were going through the different projects and the different work groups and committees about, you know, what do we do with the island home? And that sort of came up, but it would be, I mean, I certainly think putting something in the paper or doing something like that as maybe even advertisement. One thing we've never done at the island home, which has always sort of baffled some people, even when I was doing my administrator and training, you know, most facilities have a marketing director, and they focus on a lot of those things. You know, look at how, you know, our private rooms, look at this, look at that, here are our activities. And that would be really something that our marketing person would focus on. We've never needed to do marketing because our competition here is quite minimal. Besides, you know, the swing beds in the hospital and a few other things like that, we've never really had to compete with other facilities where we've had to maybe advertise that. So we've never done ads in the paper or said, you know, this is, you know, come to the island home or anything like that. But it might be worth it for, you know, every now and then to just put something out there that says, you know, here's the services that we provide. So that's a great point. Thank you.
So I think you've done a great job, Rachel, so far, and answering all of our questions about Old Island Home. So we want to shift to the other subject that I wanted you to talk about, which is your other role as overseeing the diversity initiatives that the town has adopted.
Yes.
I did ask you one other question you didn't answer about Old Island Home, which is, what is the current makeup of the 33 residents there?
Oh, yes, I do have it.
Is it a combination or is it?
So you asked in terms of male, female, as well as race. And so what we have at the Island Home right now, out of our 33 residents, we have 21 female, 12 male. That type of percentage difference is normal. We usually have more female than male. 29 of them are either listed as white or Caucasian, 3 are Hispanic, and 1 listed as Black. We had 2 who had declined to answer the question, but because it's Nantucket and I know them, I added them into the appropriate category. So some people just say, no, I'm not going to answer that. So that's ultimately what our makeup is currently in our current residents over there.
And thinking about those statistics and Nantucket as a whole, what are we talking about? Are there any statistics that anyone has now about Nantucket as a whole in terms of aging population? I know we have some information. We got a little bit from Libby about the school population.
The schools, yeah.
We know a little bit about that, but we don't know about the rest of the population.
Yeah, I think, there has been a few groups who have offered to try and determine that. I know I was part of a few meetings where we talked about, and I'm going to not recall what their true name is now, but they were known as the Nantucket Data Platform, and I believe they just
The Alan Gordon's group.
Yeah, they just, instead of being Nantucket Data Platform, I think it's something, same group, new name. They talked about that, and they had put forth a couple projects. Most of it tried to help in terms of the COVID and understanding what industries were impacted. And so they had presented to the select board, and some of the responses back would be, this is potentially really great information, great data to have that can help lead those kind of decisions and discussions. But, we really might need to know a little bit more about what our community makeup is. And because we're finding that so much of these topics are getting tied into each other. So do we truly know how much of our population has this type of diversity in it? I did a wonderful, not to go back to the Island Home, but a while ago, we did this wonderful exercise where we were doing a lot of different training there. And we put a map up of the world map and asked everybody to take a pin and their origins or where they're from or their race, nationality, to put a pin up and see how many different pins we had and how many different locations. And out of the staff that we had at the time, which we had much more staff then, I believe we were upper 60s, maybe 68 or 67. I think we had like 30 different countries and locations. So even just within our own Island Home population of our employees there at that time, we knew we had a lot of diversity in our community. And so there are a lot, our culture and tourism director, Janet, she is well in tune the different types of diverse populations we have. Obviously, some are a little bit larger than others. And so we look at those as, the predominant ones, but there are a lot of different groups in our community that, but we just don't truly know what those numbers are. And it's great that we do have some leaders in each of those that can kind of give some ballpark numbers. But it also goes back to the census discussion. We're using census numbers from 2010 that says our census is just under 12,000. And how accurate is that? So there's so many different, data points that are sort of up in the air that we try to utilize things like the school data to know what the makeup of the kids and the percentage is, and then kind of expand that out into our community and say, well, if this percentage is in this population of this nationality, then, maybe that's what our community looks like as well. So I think we are an interesting community. I'm trying to recall what it was, but when I first took this position, I was sent to a municipal managers meeting, and they were having a lot of discussions about, social media outreach and how to get across to, how to get your projects out and a few other things. So it was an all-day seminar, and I was sitting there listening to everybody, and, I raised my hand and I said, well, how do you address the populations that don't have social media? And how do you address the populations that don't read your newspaper, and they don't get their information that way? And what about what other languages are you translating your information in so that you're getting this information out to the different members of your community and things like that? Like right now we have a great public relations individual who can help us translate into Spanish. We have a few other people who can do that. So how are other towns managing that? And many of them just looked at me and said, well, we don't have that problem. We don't have to do that. And so it's, my next question was, well, do you actually not have that problem, or are you not aware that you have that group or that mixture in your community? And so I think here, while, sometimes it's very easy to say, here's maybe what we can do better. Obviously, you can always improve. I do think that we do a really amazing job here of recognizing that we have such a large diversity in our community. And maybe we are unique. Maybe not many towns have that level of diversity that we have. And then now, obviously, the next steps are, what do we do with it? So there has been a few events that have happened, I think, starting around March 2018, that have sort of lingered throughout our community, that have called some things to light. And then nationally, and around March or so of 2020, we've had some things that have really provided this movement in our community and called attention to the need for recognizing this type of diversity. And so at the end of June, I believe it was on their June 24th meeting or so, the select board did officially adopt a pledge that we had helped them develop to say that we were going to try to make strides to address this and find some way to make our community members, all of them, feel safe and open and able to communicate and get across any of their concerns that we have, and do our best to be inclusive and provide that equity throughout. So one thing that we did start to do is we've recognized that it really is a very large effort, and we do need one person to try to spearhead that effort. And until that person is in place, I've sort of been given the role to try to help coordinate that with the select board and to help carry out their initiatives and the best we can. Between myself and the Human Resources Department, we have some wonderful, wonderful ladies in our Human Resource Department that are helping us with these initiatives as well. And so we were able to advertise for this position. And to my extreme surprise, I knew we were going to get some great candidates and have probably a good handful of applications, but we got 51. And I think that's the most applications I've ever seen for a position. For me, I could, it might have happened in different ones at different times, but that to me was surprising, but it was also very telling. And the way I looked at that was to say that this obviously is very important work, and there's a lot of people who are interested in it. And if we have this many applications, we're obviously probably moving in the right direction as a community to get this position on board. So we've sort of established a way to, it's a 3-phase approach, and we are starting to enter into the 3rd phase, but we're about to start interviews. So we've had a couple different groups help us vet how we would review these applications, since there were so many. And we anticipated doing a couple rounds of interviews to kind of truly vet everybody out. But what we've ended up doing is we recently, we had a process where we reviewed the applications and saw who met the minimum qualifications that were set. And then we provided 5 questions to all those who passed that, and we vetted them. And so each of us, the 7 group, ranked and scored each questions 1 to 4. And those that provided the highest scores, we sort of then had a discussion about the candidates, what we found might have been a strength, who we wanted to interview. And through that very productive discussion, we ended up with 5 of our top candidates out of the 51, which is, to me, was not, we didn't think that we would get it down to that low of a number. And we knew that we were going to have some really strong candidates. And it was hard to do it that way, but we do see that these are 5 very strong candidates. And so right now we're in the process of interviewing and scheduling those interviews for early October. And those 7 members that did that vetting will be part of that interview process and do the same scoring. And then once those questions are scored, we will then move forward with one or two and either vet them again and do another interview or actually make an offer. And so what we hope is once we bring this individual on, they can help us with a lot of these initiatives that we have been discussing. And some people ask me a lot of questions related to this and think, well, okay, so, you know, the makeup of the town employees is not very diverse in leadership positions, but you have a lot of diversity in some of your ancillary positions. So how are you going to increase that? And is that what this position is going to do? And ultimately the answer to that is yes, they're going to help us try to find some way to create a stronger diversity. And one thing that we need to do is a little bit more, it's part of our, you know, the staffing study that I mentioned very in the beginning, trying to do that succession planning, being an island as well. You know, what do we do when, you know, the town manager retires, the chief of police retires, or the administrator at the nursing home, or just key nurses at the island home? You know, what do we do, you know, to make sure that we can keep retaining and hiring and attract, qualified, solid people? And a lot of that develops from almost growing from within. So what opportunities can we provide for people who are already here? I feel that I'm an example of that succession planning, because when I first started, you know, I didn't anticipate being here, but I sort of, through education and licensing and opportunities. So how do we provide that type of pathway for others, regardless of what their background might be or their nationality or race? And so are we providing enough strong opportunities? And so that is one part of it that this person will be responsible for. But people also need to understand that it's not just about the town employees, and it's not just about how the employees are interacting with each other. We also have the community aspect. So not only what is the makeup of our community and how those groups are interacting and how they feel represented, but also what our boards look like and how those boards are representing the diversity, as well as how our community members are interacting with different departments. So it's just such a huge encompassing responsibility. And some ways that we've tried to tackle that is, instead of bringing somebody in and saying, okay, try to find some things to do to make our community better, we started developing an RFP or a request for proposals to help create that strategic plan, as we call it, to help say, these are the next steps that we need. Here's the gaps in what your community has right now. Here are some areas that you need to focus on. And this position, once they're hired, will help guide that process, work with the consultant, and help develop that strategic plan. And then they would be ultimately responsible for the oversight and management of that. So that's, it's a lot. And, I think that we're on the right path of creating that position. And especially in these type of times where, it's really hard to bring on new positions right now. And, with our economics so unknown and a lot of people and the impact that COVID has had, but to still make that a priority, I think that speaks a lot of volumes to, what we want to do as a community and what our values are, and making sure that everybody has representation.
Any members of our committee have any questions for Rachel about the, yes, Kathy?
So you mentioned an RFP, so you're writing did I understand you to say you're drafting an RFP for a consultant to create a framework for this new person to then execute? Is that what you said? And when is that?
Yeah.
When does that consultant come on board?
So we have bounced back and forth, and I say we, the select board has discussed it. We've discussed it internally, town admin. We've talked about it through, we have a Nantucket employee empowerment team that has a few representatives that were determined to be part of the selective process. We also have a Council for Human Services that's been up. So everybody sort of has had this conversation, and it ends up being a little, cyclical, and what comes first. Do we hire the position, or do we put the RFP out? Where do we go? And I think the consensus that we're seeing is, once we get this position or this person in place, they can then review this request for proposals, advertise it, and they would be part of the process. So, you know, Massachusetts procurement laws, they're there for a reason, but sometimes they're a little cumbersome. And what is required with a request for proposals is there's a advertising period. And then once you get those proposals in, you have to evaluate them. And you have a certain set of comparative criteria. And we want this position to be a part of that process to help determine which of the proposals and which consultant we would like to engage as the town to help build that strategic plan. Some of the data points that you asked about earlier, Gary, in terms of what is our actual population and what is the diversity breakdown in our community, some of the things that we ask in that request for proposals is to help determine that information. And that will help guide, you know, what our goals are in the strategic plan. And so one thing that we've decided is that I think it's important, and as do others, to have that person in place and then be a part of that process from the beginning. And that will ultimately be their first initial task, is getting that request for proposals finalized, advertised, and get the consultant in on board. A lot of times when you're new to a position, especially if you're new to the island, you spend a lot of, like, say, your first 100 days or so, you'll spend a lot of that time meeting the different groups, engaging with the community, meeting key stakeholders and leaders, meeting individuals like you, and understanding what's important to different individuals. So we think that that will happen as they assimilate into the community. Even if they're already from here, they might not know those different groups. So as they're assimilating, the RFP will be in process, and then they can then start working together in tandem to create what that strategic plan will look like. So I say it's in draft form. We've had so many different people review it. It is probably the most detailed RFP I've seen in my tenure of working for the town. I'm sure that there's others out there, but it's a very detailed document. And so, you know, sometimes we are worried that we're making it too detailed and we're not going to get responses. But if it's anything like what we got for the applications, I think that there'll be some strong interest in some groups out there that'll still respond. And so it's basically ready to go. And hopefully once we get that person in, we'll start advertising it. If all goes well, and don't hold me to it, I would love to see that we could get an offer out to somebody and start doing references and background checks by mid-October. And that person maybe could get on board around November, which would also be about the time that we did the RFP. So it's looking like hopefully November would be our target month to get those initiatives really starting off the ground.
Good. Any other questions? None that I hear of. So, Rachel, I think we'll let you off the hook. You're certainly welcome to stay and listen to the rest of our meeting.
Wonderful.
We have more things to go, but we appreciate your excellent knowledge and explanations of a lot of this complication that we read about. As I say, those of you that haven't seen the Inky this week, take a look at the letters to the editor. You see the emotional attachment people make. Some people are only interested in the money. Other people are interested in the view. And people are worried about the seniors. People are worried about, anyway, it's a very complex subject. And I'm glad we got a good preview today. I
will say that in all the projects that I've seen for the town, you know, I've expressed frustration sometimes where it's like, we need to do something. And it seems like this has been a very long process in determining what do we do for the island home. But I think the reason why that is it's probably one of the most complex projects. You have that emotional side, you have the coastal resiliency sustainability side, you have the nursing home side, you have the healthcare side, then you have the finance side. So I think it's one of those projects that this town faces that really touches on so many different things. And it is so complex, and that's why it's taking so long. So I would like to look at it as, instead of there's no action being taken, I look at it as there's an extreme diligence being done to make sure that we're trying to meet all the right things. And I really appreciate your time, and thank you for having me. So hopefully I provided you all with some good answers, and I would love to come back sometime. So thank you all.
Okay, in the future. So the next item on the agenda, we have a quorum now. And since we have the quorum, with Bill Sherman, we can actually move to approve the minutes from the last meeting. So Kathy, everyone look at the minutes. She sent it out. Does anyone need to make any changes, or would you like to, like to make a motion to approve the minutes of the last meeting? They were very detailed. We had a great meeting with Denise and George at the last meeting. They gave us a lot of financial information. We asked a lot of questions and they answered them all. And I mean, Brian and Denise were terrific. And so is there a motion to approve the minutes? Yes,
Motion
Don?
to approve.
Second?
Motion to approve the minutes.
Okay, all in favor? Just raise your hand.
Aye.
Yep, 1, 2, 3. Bill Sherman, yep, okay.
Yes,
Approved. Thank you. Next item on the agenda, I have.
I think we have to approve the agenda too.
Pardon
Do we
me?
have to also, do we also have to approve the agenda?
Okay, let's take a vote on that. Who wants to make that motion? To
So
approve
moved.
the agenda? Second,
Aye.
all in favor? Raise your hand. I can see everyone's hands are up. Thank you. Okay, that's approved. Thank you, Kathy. So now we have those 2 items done. I just put on here, update letter to select board on noise abatement. At the last meeting, Bill Sherman made the motion, which was approved, that I would send a note to the letter to the select board suggesting that an ad hoc committee be formed to deal with the complex issues of noise problems. I had brought up the fact that the major construction projects during the high season were driving a lot of the seasonal residents crazy. And unlike many communities that are seasonal like ours, there are no differences in the work hours. And those work from 8 in the morning till 10 at night, 6 days a week, and on Sunday, almost the same amount of time, a little less. Whereas most communities don't permit that. And at that conversation, we also talked about the fact that some people were troubled about the noise from the parties at the Tom Nevers Park, and other people had concerns about the noise levels from some of the equipment that landscapers were using. So and that's why Bill Sherman wisely suggested maybe we have to get town to put an ad hoc committee together to come up with some suggestions, because it might be a subject for a warrant article at the upcoming meetings. And so I haven't figured out exactly how to write that. I looked at some of the, I have a Florida home, and I looked at some of the regulations that they have there. I just wanted to read to you what the preamble to one of the regulations said from the Palm Beach County. It says, whereas excessive or unusually loud noise interferes with the peaceful enjoyment of residential property, can cause hearing loss, interferes with sleep, distracts from individual pursuits, and can cause serious annoyance and irritation in residents of Palm Beach County. And whereas excessive sound levels constitutes a menace to the public health, welfare, and the quality of life in Palm Beach County. And then they went on to pass these rules that say all major construction in the summer months, at least in the winter months, in the high season in Florida, and those months are December, January, February, March, and April. The construction can only be between 8 and 5, and not on Saturday, Sunday, and legal holidays. So that to me would be great, but I don't think that Nantucket is quite ready for those restrictions, and I'm still working on thinking about how I pose some of this in a letter to select board, saying basically we think some changes ought to be made. It does affect the quality of life of the people here during the season, and people are here a lot longer this season than in the past. Anybody have any other thoughts to add about that as I'm thinking about what to write? I don't have a draft to show you yet because I've been twisting and turning about it. Peter?
Yeah, I think that we need to be a little bit more certain than some changes. It may be that 8 to 5 gives that amount of certainty, although I think 8 is already in the Nantucket.
7:30 now. 7:30 now.
7:30, yeah.
7:30 to 10. 6 days a week.
And at night, yeah, so eight to
Heavy
5
construction.
or 8 to 6 or something
Yeah.
because I think just saying some changes made leaves them just saying, what do you really want?
Well, wouldn't it be nice? What do you think if we could convince them? I don't know if the annual town meeting would buy it. If we could convince them that during the heavy season, say from June through mid-September, that people would get a break on the Saturday, Sunday, and holidays like July 4th, stuff like that. You think that that would fly? What do you think, Rachel? Do you think the town meeting would ever consider stopping heavy construction on Saturday, Sunday, and holidays in heavy season in July, August?
Really hard to say what people would decide. I've stopped predicting town meeting a long time ago. But I think it would be worth your effort to put forward. I did want to mention, noise abatement has been one of the discussions that I believe our board will be talking about for a upcoming town warrant article that's put forward from the select board. And I am I believe it's on the October 14th select board meeting is when they're going to be talking about potential warrant articles coming up for the next time. So if you are going to do a letter or suggestion, it would be great to get that before that meeting, because then, your voice could be heard at what you might suggest might be a great solution for the noise abatement. Because you're right, it is, I believe it's June 15th to September 15th right now, nothing between 10 p.m. and 7 a.m. So if you were to add, exclude holidays, as well as weekends. Both Saturday and Sunday might be a hard sell, since there are a lot of groups that work on Saturdays, but Sundays and holidays might be a nice compromise as a solution or a suggestion from this group.
Good idea.
I believe that's only in the historic area of the town.
It could very well be.
Right. In the residential,
It doesn't cover the whole town
I think you're right,
or
Lou.
the whole island.
I think you're right. Peter?
So covering the whole town would be one change that we should suggest. I guess I'm of two minds of this, but it needs to be less than it is now. Right. And that may be why you originally said something ought to be improved. And I think that Sundays, although there's religious connotation to that, with the blue laws, but taking Sundays out would be a good idea, and maybe a half day on Saturdays or something like that.
Okay, well, I'll try to put something together, and maybe I'll run it by a couple of you guys. I'm not going to try to do it by committee because things don't get drafted that way, but I might send a copy to Peter and Kathy or something. So let's talk about future meetings. We didn't make a final decision at the last meeting, and it looks like because of this pandemic, for better or worse, our committee will be able to continue meeting for the foreseeable future. I don't know once the pandemic gets cured, if it's ever going to get cured, or once they have the vaccines, if the state of Massachusetts will recognize that it's not a bad thing to be able to have committee meetings where people can participate and be included in the quorum electronically. But let's assume, at least from everything that I've been reading, is that the pandemic won't be behind us between now and next summer. And so it's likely that we'll be able to keep meeting. I don't know if I'm pessimistic or optimistic about next summer. But in any event, if that was the case, I'm kind of torn as to whether we ought to meet every 3 weeks or once a month between now and then. I think 2 weeks is too much, but I don't know whether we should do it. Yeah, Peter, what do you think?
Yeah, I think that we have to look at this in two dimensions. A regular meeting every so many weeks, which is one dimension, but even more importantly, I think as Rachel brought up, the town warrants are starting to come forth, and we need to structure something pointedly around that so that we can discuss those things that are of importance to us prior to the town meeting, and then do whatever the committee appropriately can do to add our, support or our consternation prior to the town meeting.
Don?
So, to be so focus folks around, the schedule for the town meeting initially, and then.
But that town meeting is April 5th. That's April 5th, so it's a long time between now and then.
Yeah.
Don?
I think we can make it once a month and then schedule special meetings as
Okay.
necessary.
If we can get the time from the town, yeah, that's a good idea. Whether or not they'll be receptive to us meeting, with special meeting depends on whether we can get the ability to telephonically do it.
And I think doing it on a Saturday probably won't interfere with regular town
Okay.
business.
Okay, that's a good idea.
That's true. The town already said nobody else meets at our time or on Saturdays, so I think it's pretty well open.
So should we just figure the next several now today is the, what's the 26th? Yes. Today's the 26th, then I probably ought to keep away from a Christmas time. So we can schedule meetings for, Kathy, take a look at the calendar.
October 24?
Well, day before Christmas is we ought to be a little more flexible on Christmas time. But let's talk about October. The next meeting in October can be, one of the Saturdays in October.
24th is a Saturday,
Okay.
about a month away.
What do you guys think about that? It sounds okay?
Sounds okay to me.
Yeah.
Okay, so let's put down October 24th for the next meeting. And then for November, we'll keep away from Thanksgiving. Thanksgiving is a Thursday, so we could do the 21st or the 28th. Maybe let's do the 21st. Okay, November 21. And for December, that's the Christmas time.
Do we want to take December off maybe? And just then early
Okay.
January?
Well, December 19th would be 4 weeks from the 21st.
If that's getting a week before Christmas. Would you folks like to take a month off? We usually take 6 months off, so that would be. Okay, let's take December off. Subject to if we feel we have to meet then, we can reschedule it. And so then the meeting after that will be January 23rd, say.
I think at that point, we maybe want to start to get into the articles that are going to be coming up on
Yeah.
town meeting.
So then between now and then, we'll decide what do after that January 23rd meeting. By the way, what Denise mentioned last meeting was that the Finance Committee is starting to meet soon. Georgia can tell us about that. They're going to start talking about the warrant articles, and everyone's invited. Anyone can zoom into that, and so that will enable us to participate if we want to, not as a committee, but just as a member of the public. Something we haven't been able to do before because it wasn't Zoomed and it was locally done, and none of us were on island in the time, in January, February, or whenever they were talking about these things. So we do have the opportunity now to learn much more about thinking behind a lot of these proposals, which is probably, we're not going to change a lot, I don't think, but at least some of you who have the time and would like to see how the Finance Committee is dealing with some of these warrants before it gets to the annual town meeting, where who knows what happens. So I'll just mention that. And maybe at some point when we get the schedule, Denise or George can send us the schedule for the Finance Committee meetings, and we can share it. Kathy can send it around. So those of us who would like to Zoom in on those meetings can do so. Kate Shea, I didn't ask you if you had any public comment. If you do, we'd be glad to hear you now. I'm sorry for not asking you sooner.
No. Thank you for asking, but I'm really just here to listen. And since you're on Zoom, it was an opportunity.
Great, we're thrilled. And if you're interested in joining our committee, I don't know, by the way, you all saw the letter to the editor in last week's Inky. This was something we agreed to do, and we wrote the letter, and Bill Gardner sent it over to Marion, and Marion published it. And it was a nice letter where I mentioned, a letter to the editor saying, we have this committee, we meet with town officials, and it's an opportunity for people who want to participate in a modest way in Nantucket town government to join our committee. And if you're interested, contact Maureen Coleman. I haven't heard anything yet. Kathy, have you? The applications haven't been deluging, unfortunately. Maybe next year I have to think I might even pay for an advertisement in the Yankee that say, hey, we're available. And we have great meetings with terrific people like Rachel and other town officials. So we know what's going on. We're allowed to ask questions. They want our input, and we need more participation. But I haven't heard yet from Maureen whether that letter to the editor produced any results. But I thank you all for your efforts in approving that, and I thank Bill for getting it in the newspaper. And if there's no other items to talk about today, then I'll be glad to have a motion to adjourn. Anyone want to move to adjourn?
So move.
Okay, Kathy, you were going to say something, but you're on mute, Kathy.
Oh, sorry, yes. So the question, who would we invite to speak at our next meeting?
Okay, that's a good question. And the next meeting is
October?
October. So one member of the select board we haven't met with yet was Melissa Murphy. So that she was a possibility. Anybody have any other thoughts about who we might want to? I mean, we can talk about some of these things ourselves, but so what do you think? You think we should try Melissa?
I think it's a good idea.
Okay. So Kathy, why don't you send her a note and see if she's available? And then we'll get another view from somebody on the select board. And we can ask them the questions I didn't ask Rachel about. Are we ever going to get paid parking? Or are we ever going to get a noise ordinance and things like that?
Do we want to have an alternative, like, because we had talked about Marianne Stanton. I don't know if that was brought up with her, but probably not.
Bill mentioned it in a note to her, but let's try Melissa first.
Okay.
Let's see what happens.
Barry,
Yes.
this is Lou.
Hi.
I'd like us to think about maybe having the rep from Nantucket to the Steamship Authority before our committee. Every one of us at some point in time does use the steamship.
Yes.
And I'd like to find out what's happening over there and have them fill us in as to where they're going in the future.
Okay, that's, gee, I know, what's his name?
Is that
Rob.
Matt Lowell?
Who?
Rob, isn't it?
It's Rob.
Yeah.
Is it Rob?
Rob Randy?
Yeah, Rob Rainey. It's right, Rob Rainey.
Rob Rainey, it's Libby's brother. I think that's Libby's brother.
Oh, is that right?
Yeah, I think so.
Yep.
I mean, I know the Rainey family. I ask them to do something once a year, or once every year.
But maybe at some point we can have somebody in from, or have him come in.
Okay. Okay, that's a maybe, Kathy.
Okay.
Melissa first. Anybody else have thoughts? Okay, so we have a motion to adjourn. I think all in favor, just raise your hands.
All right.
Hey, everyone, stay safe, wear a mask, and enjoy this nice weekend. Looks like at least today's going to be gorgeous. So stay safe and have a good weekend. Take
Thank
care.
you,
everybody.
you too.
Bye.
Thanks, Kathy. Bye-bye.
Thank you.
Bye.
Bye.
Bye now.
Thanks, Bill. Thanks, everybody showed up. That was great.